I'm very glad to present one of my PhD studies titled Bone Resorption Status in Parturient Dairy Cows from a perspective of bone markers related to osteoclast activity. Parturient dairy cows lose a large amount of calcium into milk. In US dairy herds, 50% of multiparous cows develop milk fever or subclinical hypocalcemia at the onset of lactation. Dairy cows which fail to adapt their physiological change associated with a change in calcium demand develop hypocalcemia. Maintenance of calcium homeostasis is challenging for pre-parturient dairy cows because there are some factors to affect their calcium demand. Rapid fetal bone growth, followed by calcium-rich colostrum production. Pregnant dairy cows reduce feed intake, especially late pregnancy. Therefore, the bone calcium supply calcium from bone should be important in this period. However, the bone metabolic status is not well understood around this period. This is a schematic presentation of Osteoclast Genesis. Osteoclast Genesis is the osteoclast cell differentiation. Osteoclast cell is regulated by these cytokines, rank ligand and its receptor, also osteoprotegerine called OPG. TRAP5B is an enzyme produced from osteoclast cells. The rank ligand promotes osteoclast cell formation by binding its receptor on precursor cells. In contrast, OPG inhibits osteoclast genesis by acting as a decoy receptor of rank ligand. Rank ligand, OPG, and TRAP5B are released into circulation during osteoclast genesis. So by measuring these blood concentration, we can estimate how the osteoclast genesis goes. Additionally, bone collagen fragment is released as a result of bone resorption, and it's used as a bone resorption marker in several studies in human medicine or veterinary medicine. Now I share with you some research discussing the bone resorption in lactating cows. Some studies said blood concentration of bone collagen fragments suppressed for a few days after calving. On the other hand, we recently found the elevation of blood activity of TRAP5B elevated from 1 week before calving. From the current theory, we don't know when the cow actually activates their bone resorption and become ready to supply their calcium into blood. So the objective of this study was to explore osteoclastic bone resorption status in parturient dairy cows using the markers of osteoclast genesis, OPG, and TRAP5B. We also compared these blood concentration between healthy primiparous and multiparous cows. We used 18 Holstein Friesian pregnant cows raised in our school farm, 9 each of multiparous and primiparous cows. All of them underwent normal calving process and stayed healthy during 5 days after calving. Blood sampling was conducted from coccygeal veins at the 20-day before parturition, 0 day immediately after calving, 0.5 days, 2 days, and 5 days after calving. This is a biochemical analysis that I conducted. OPG was measured using the commercial ELISA kit, and TRAP5B was measured using the fluorometric method, as we previously reported. And we also measured calcium. Statistical analysis was conducted using SAS Enterprise Guide. This is an overview of animals. Average age at calving were 3.0 years old in primiparous cows and 4.8 years old in multiparous cows. Average parity was 3.7 times in multiparous cows. Prepartum body condition score were ranged from 3.0 to 3.50 during dry-off period. Average body weight at prepartum period were 594 kg in primiparous cows and 729 kg in multiparous cows. Average daily milk production after 5 days, during 5 days after calving, were 19.8 kg per day in primiparous cows and 28.1 kg per day in multiparous cows. Prepartum and postpartum dry matter intake were calculated from the appropriate equation of NRC. All values were greater in multiparous cows compared to primiparous cows. This figure represents the change of serum calcium during the experimental period. Multiparous cows were, as we expected, they reduced the serum calcium at the day of calving, just after the calving. This is a change of serum OPG. The point I want you to remember is in multiparous cows, they exhibit a higher serum OPG concentration at the prepartum and became lower after calving. On the other hand, primiparous cow did not show such a change. Therefore, we found a significant group difference at the 21-day prepartum and 0.5 day after calving. This is a result of plasma TRAP5B activities. These levels were peaked at calving in both groups, and its levels were higher in primiparous cows during whole experimental period. As I mentioned, the goal of our study was to estimate the bone resorption status in healthy primiparous and multiparous cows. Before discussing our results, I will go over the physiological effect of OPG. OPG prevents bone resorption in overreactive mice rats, and also OPG deficient mice develop osteoporosis. Therefore, OPG is known to protect bone from resorption, which means the reduction of serum OPG explains a change in bone resorption status. Based on our study, they exhibit the plasma TRAP5B activity peaked at calving. Plasma TRAP5B activity is known to correlate to the osteoclast number. Therefore, they seem to increase their number of osteoclast cells at calving. This is actually corresponded to a previous study. The plasma TRAP5B activity began to increase before parturition. This is a schematic drawing what we assume to happen in the bone of multiparous cows during experimental period. We saw the reduction of serum calcium and OPG and increase of plasma TRAP5B. With these results, during dry period, the bone is protected from resorption with the increased level, higher levels of OPG. But after calving, less protection with decreased levels of OPG, and also increased osteoclast cells with increased levels of plasma TRAP5B. To sum up the ideas, the bone seemed to ready to supply the calcium into blood at the calving. On the other hand, primiparous cows did not show such a change in serum calcium and OPG. However, their plasma TRAP5B levels increased as the multiparous cows did. Based on plasma TRAP5B activities, they increase the osteoclast number at the calving. It seems to increase their bone resorption. However, this cannot be explained by our findings of OPG levels remain the same. Based on our study, we found the multiparous cows changed her bone resorption status before and after calving. There are some facts that support the reason why this change only happened in multiparous cows. Calcium demand is decreased after ceasing lactation, so dry cow need to replenish bone mineral lost during the last lactation. Also, we found more colostrum production for 5 days after calving in multiparous cows. Therefore, the multiparous cow faces more dramatic change in calcium demand. So probably they need to change their bone resorption status in this period. In conclusion, we found the healthy multiparous cows showed different bone resorption pattern around calving from the healthy primiparous cows. This is the first report to describe the serum OPG changes. Further research based on our findings make it possible for us to understand the role of bone resorption in hypocalcemic dairy cows. Thank you for your attention. Now I open up for the questions.
Thank you very much for this interesting presentation.